Hi, I am here with Margie and Rona, who wonderfully wrote the genetics chapter. How are you both?
Very
Great,
well,
thank
thank
you.
you.
Thank you both for your amazing contribution. And it was definitely such an imperative inclusion because we have to talk about this because clinicians are using it and they don't necessarily have the expertise or the knowledge behind what they're doing. And it was so important that we start to educate and inform everyone. But tell us first how both of you got connected into your current roles and what you're doing with your careers and how you connected to naturopathy.
You go first, Rona.
Well, I actually met Margie, 20 years ago. I was
right.
a senior laboratory scientist at the Children's Hospital in Perth doing diagnostic genetic testing, so for inherited diseases such as cystic fibrosis and the breast cancer genes. And there was some technology that was out at the time, so Margie came over to our lab as she was a counterpart in a lab in Victoria. And we got together then sharing some new technologies and trying to learn from each other. And then years later, we ended up in this nutrition medicine, nutrigenomics space. And it seemed like a very good fit for us to work together.
Yeah, so Rona and I very much come from mainstream medicine and a pathology background, and then we've branched out into nutritional medicine in slightly different ways, but the synergy has been really great in terms of our areas of interest, how they intersect, and we've had some occasions of actually presenting together as well, which has been really fabulous. So, and we've had a road show with Rona to New Zealand, and that was when some big storms hit through Wellington, and I encouraged Rona to go to Wellington, only to find that Wellington was probably one of the worst hit places, and Rona was in a hotel room by herself when the storm went through, and the earthquake, actually,
It was the earthquake, yeah.
Yeah, the earthquake. So Rona's building shook, and she nearly got her head taken off with an iron flying out of a cupboard. And I felt really bad because I'd encouraged Rona to go to Wellington, and I got caught up in it in Christchurch, which was pretty bad. It was, one of the epicenter.
Yeah.
So needless to say that that presentation was cancelled in Wellington, and poor Rona then had the terrible time of flying out while the storm was still going. So she got the worst of it. So I had to take Rona out to a very nice dinner when we got to Auckland. So
yeah, it was character building. It was,
oh.
but the seminar series was actually very good. It was really, really good.
Sure, it was a little bit more adrenaline.
Yeah. So in terms of where our professions have gone, I do a lot of educational work with various companies and different organisations. I teach GPs, compounding pharmacists, naturopaths about nutrition medicine. So at the moment I would be normally in Melbourne or Sydney now running some courses, but a lot of these have got to go online now, obviously. And I am writing a seminar series on pathology testing for one of the supplement companies that want to do a roadshow in Australia and New Zealand.
Amazing. And Rona, Margie, what about you? Where are you sort of at with the DNA company that you're working with?
Yeah, so we've really branched out and become a little bit global in a way. We've been really focusing on our patent. We've got a patent in the gut dysbiosis area, and we specifically looked at irritable bowel syndrome and autism. And then coupled with that, we're working with a teaching hospital in the US, actually 3 teaching hospitals in the US, to run 1,000 patient study looking at nutrigenomics. So very much what the chapter's been written about, and bringing that together with pathology to actually show improvements in patient health. And that's what we're really hoping to achieve. So that's kind of like a dream come true for me, because we really want mainstream medicine to start to understand this area, as well as obviously all the practitioners that use our testing at the moment. But I think that would be a major breakthrough in that particular area. And then we've also just filed a patent recently looking at a unique way for improved bioavailability of nutraceuticals. So That's another really important piece. And we're coupling that with a study to neurogenetics and neurodegeneration, and looking at ways that we can actually use these nutraceuticals to improve health outcomes. So we've got a lot going on. We've been working very hard in more the R&D area. Obviously, the genetics is a very important piece in terms of nutritional genomics. We've expanded our screen to 167 DNA changes now. And I think one of the very important pieces during this COVID time that we're in is that there are so many publications coming out now that are actually referring to those nutritional genomic SNPs and how they can either decrease or increase our risk in terms of viral infections, and what our risks might be in terms of contracting COVID, and then indeed our recovery. So I think, you know, we don't have a vaccine. So I think one of the best ways we can invest in ourselves is in our health, understanding our DNA and reducing our risk, and really understanding where nutrition and supplementation intersect with our DNA. So it's a fascinating time to be seeing that literature come out.
It is. And I think
in the area we work in.
Yeah, and I think it'd be really fascinating to see how it influences health and health outcomes. And, you know, it's such an evolving science in this area with so much research being invested. So, you know, I was really, really pleased to be able to include it. And it's really just a taster, you know, the chapter. It's such an introduction to sort of starting to understand all this area. And, you know, and absolutely people need to continue their education because it's evolving at such a rapid rate.
Oh, I totally agree. It's definitely a burgeoning area, nutritional genomics, and then coupling that with pathology. And I'm sure Rona's series is going to be great that she's talking about. So, you know, it's really important to bring all that information to bear. And with any testing, we need to understand what the testing can tell us and what the testing can't tell us. So what are the limitations? Every test has limitations in pathology. So, but it also has advantages, and we need to understand technologies that are being used. So for example, we use a validated genetic test, but there are other companies that use really large arrays, and you might get massive amounts of data. But the flip side of that coin is that that data may not be accurate. So if you wanted to treat patients, then you need to think about, where does your data come from, and is it validated? How reliable is it? And I think they're key pieces for practitioners to really start to delve into.
Yeah, I would agree. I think one of the biggest things that we face or we find with practitioners is that it's not only about which tests to use, it's when to use them appropriately. And there's lots of testing out there, and it's not appropriate just to say, well, it would be useful to have that information or those test results. If you can't action those test results, then there's no point in doing the test in the first place.
Yes.
And I think genetics is one of the genetic profiles are one of the things that's so misunderstood, which is why I think it was really important to include this chapter in the book, because a lot of people actually treat their patients based on the genetic SNPs that they find, and that's not appropriate at all, because we all know that, you know, genetics isn't your prescription for disease. It just shows your biochemical vulnerabilities and what areas that you need to focus on. So educating the practitioner about this, I think, is really key, because we've got so many really good tools at our disposal, but we need to use them properly.
Yes.
Yeah, so I totally agree. So if, for example, you're looking at MTHFR and someone has 60 to 70% reduced enzyme activity, that doesn't mean that you necessarily need to leap in with activated folate. I think, you know, one of the best proxies for that is looking at homocysteine. So how well is a person actually breaking down homocysteine and reducing it back to cysteine and methionine? And, you know, that's also a very good proxy marker for DNA repair. You know, if that reading's between 6 and 8, then your body is making faithful copies of its DNA. But just because there's a risk and it might be highlighted as a red dot in a report doesn't mean it needs to be actioned.
Yeah.
But what it is pointing out, this is a genetic vulnerability. And then the flip side of that is, where does that fit in terms of biochemistry? How can we measure that? How can we monitor that? And then what can we actually clinically do to help that patient? And I agree with Rona. So often I will hear from practitioners, oh, but I'd really like to have it broken down into A, B, and C. And I've said to them, well, if you know that information, how is that going to be clinically relevant? You know it, but what do you do that's going to be clinically different to just knowing this one particular point? Yeah. And the answer I get, I take your point. But, there's always that thing of it would be nice to know what A, B, and C are, but it doesn't change the clinical treatment. Yeah. And I think that's a really important piece. If it doesn't change the treatment, then it becomes an academic thing and it's nothing you can really apply in a clinical setting. And I think that's a key piece because of Rona's background and my background in pathology is that, we're always really looking for that information. What's clinically relevant? How can we apply it?
Yeah.
Sorry to speak out of turn, Rona. I hope that you...
No, that was good.
No, it's a dialogue and you can see how well you wrote together, which is lovely, and you complement each other. So thank you. But look, thank you both so much for your contribution, and I'm really, really grateful that we could include it in the text. And if you'll still talk to me for second edition, I look forward to seeing that as well, because it's such a growing area.
Yeah, so, it was a joy to write, and we, it was, it came, I think it came together very well with, like you say, we complement each other.
And also thank you for the opportunity, Leah, to contribute. I think that's been great for us as well. So thank you.
Thank you.
Thank you both. Thank you.
Thanks.